Hi, everybody. Welcome to Paging America, where we explore the power, profit, and politics shaping American healthcare and what you can do about it. I'm your host, Miles Baker, along with Dr. Rob Davidson. Thanks for tuning in. Later on in the show, we have a special guest, Dr. Priya Paul, where we're going to dive into the details of the MAHA Report. It's a great interview, so please stick around. But before we move to that, everyone's talking about it, and we got to talk about it. Senator Joni Ernst of Iowa said everyone's going to die. Rob, did you hear it? Did you hear her quote?
I did, and I think we're gonna play it for the folks listening who maybe didn't hear it.
We'll toss it to the quote now.
1.4 million. 1.4. They are not eligible, so they will be coming off. So people are not. Well, we all are going to die. So for heaven's sakes.
Okay, so
yeah, what a
wild,
yeah. What
as a non-medical person, I want your take, right? Just as a layperson, not involved in like patient care and trying to prevent people from dying and all that. How does that land with you, Miles Baker, my political friend?
What it sounded like to me is a old Republican trying to be a MAGA Republican, but doing it poorly. Like, I'm going to in order to stay current in the Republican Party, I'm going to be crueler than I normally would be. I'm going to try to be funny, failed. And it just landed so bad. And then she tried to double down on it with that little walk in the graveyard.
Oh yeah, that's right. She was in a graveyard, and I don't think we want to play that, but basically saying, news for you, the tooth fairy doesn't exist either. We should have done a disclaimer to not listen with your kids.
It didn't make any sense. Like, the whole thing didn't make any sense. And so I just think Republicans, old school Republicans, were never funny. Like, they were humorless folks. We can talk about the Democrats being humorless now, whatever. But 10 years ago, it was the Republicans that were extremely humorless. So when they try to do the Trump thing, where they're cruel and funny at the same time, it lands with such a damn thud.
I mean, I will say from sort of the medical perspective, so I'm an ER doc, you know that. And often in the ER, people have the false conception, maybe from watching shows like ER, where everybody gets coded and almost all of them survive, that somehow the folks in the ER were trying to save everyone's life no matter what. You know, somebody with stage 4 cancer who doesn't want to be saved, who said, these are my wishes, I want to be comfortable. And we're like, no, we got to save your life. That couldn't be further from the truth. I will tell you, some of the most compassionate end-of-life folks I've ever met are longtime ER nurses who have seen people suffering, who very much understand everybody dies. Some people die in horrific ways. Some people suffer for long periods, and some people are allowed to pass in very sort of respectful ways that honor their wishes in great comfort. Yeah. And her saying that shit so flippantly, right? A senator who has lifetime health insurance, who will almost certainly not die unnecessarily, right? Joni Ernst will probably not die of a disease that could have been caught early from screening for cancer, like breast cancer or colon cancer, but probably wouldn't end up with something that's gonna kill her because she didn't get that care, or die from complications of diabetes that was untreated, or from cutting her pills in half. And a lot of people will. A lot of people I see do suffer those unnecessary or premature deaths, or unnecessarily painful or gruesome deaths, because of lack of access to healthcare. Whether it's because their deductibles or copays are too high, or their premiums are too high, or they did qualify for Medicaid and they fell off the rolls, or now we're talking about going forward. And this is all in the context of people at her town hall saying, if you pass this horrific, big, ugly bill that came out of the House, people are going to die, parentheses, unnecessarily. And she took it, well, this is my opportunity to be cruel and funny at the same time. Like you said, cruelty came through in spades. The funny part completely left the building. It should be offensive to people, and we shouldn't attack her based on the offense of it. It's just the base of it that either she doesn't get it, right? She doesn't get that that's what they're saying, or maybe she does, and she has no way to actually defend it.
That's the thing about her. I think she does, and so she's just play acting the new Republican Party, and it's so icky. She did this with Hegseth. She totally folded on Hegseth, and then did this. She's running in 2026. Hard to beat a Republican in Iowa.
Yeah.
Very hard. Fingers crossed, though.
Somebody announced, right? I think J.D. Skolton announced that he's running against her. And I mean, just because something is hard, A, we should still do it. B, doesn't mean it's impossible. I mean, people did not think Barack Obama could win the nomination in 2008 because Hillary Clinton had it all locked up. And he said, nope, this is the moment. This is what people are looking for. And it happened. Yeah. So who knows? Yeah, particularly ghoulish. Maybe we need to come up with an award each week for the biggest ghoul. It doesn't have to be Republican, but she gets it this week.
We're giving away an award. She gets it this week.
It might be named after her from here on out.
Oh, yeah. Okay. We'll give the Ernst Award.
The Joni Ernst Award. Yeah. Oh, my God. Okay. Great. Well, and then other big piece, I know it came out a few weeks ago, the MAHA report came out, right? This much anticipated and promised report looking at disease in the U.S. and chronic disease and how RFK Jr. and HHS and our federal government were going to attack disease. So it came out, it's been a few weeks. Mind you, it's about 76 pages long, so it took a little time to digest it. There have been a ton of hot takes, a ton of political takes, a ton of medical takes, a ton of headline takes, and a little bit of diving into it that I've seen, but maybe not as much. And so, the biggest criticisms are that there were fake citations, right? There were things with labels from OpenAI that were likely just generated in ChatGPT, and someone forgot to take out the label. And I think Caroline Levitt said, there were some formatting and editing issues that have been cleaned up, and it will be provided in the final report.
Pretty big formatting issues.
Pretty big formatting issue. Hey, kids, if you're handing in your term paper and then you had it written by ChatGPT, maybe get rid of the little labels that tell someone it was written by ChatGPT.
The kids do that, Rob. The kids will get rid of the labels. It's the federal government that does it now.
And this gets back to a lot of what we've been talking about. These guys are certainly, some of the things they do are scary for people that they affect. But honestly, they're just grossly incompetent at the things they try to do that either are not so bad or even the things that are really bad. They're a bunch of buffoons. They don't even know how to generate a fake report without letting us all know that's what they did. So that's some of the criticism, certainly criticism of the report because it comes out against vaccines, comes out against fluoride. So we have a great interview coming up with Dr. Priya Paul. She's an infectious disease doc, researcher in HIV, and a board member of the Committee to Protect Healthcare, healthcare advocate, and physician scientist. Excited about that. Spoiler alert and warning for those of you, it does get a little heavy into the science, but I think there's enough of the non-science sprinkled in there that it can be appealing to all. But yeah, I think this is a great interview, and I think people are going to enjoy diving into the MAHA report.
Great. Let's start with that. We want to welcome Dr. Priya Paul. She is an infectious disease physician and a scientist who studies innate immune pathways in HIV. She additionally sees patients in the hospital with a variety of infections and runs HIV clinical trials. She is a member of the board of directors of the Committee to Protect Healthcare. Dr. Priya Paul, welcome.
Thank you. So glad to be here.
Well, I got to say, I'm really excited to have you here because as we talked about a little bit before this on the pod, the MAHA report, RFK Jr., HHS Secretary's MAHA, Make America Healthy Again report came out. It's been a few weeks now, but there's a lot in there. And I think probably good to digest it a bit, let all the hot takes come out early, let all the online comments come out, and then kind of really dig into it. And, we always say on this podcast, Miles is sort of the political, non-medical voice. I've been, doing medicine for more than half my life. But literally, I published one study in 2000 when I was a resident, and I don't remember how to really write citations, and I read lots of journal articles and synopses of them, but I'm not an expert in this, and you are. You're like crazy smart research person who sometimes sits in the lab and mixes beakers and conjures all that up. And so you seem like the perfect person, particularly your role in advocacy on your own and with the Committee to Protect Healthcare, and then your real world job of doing science. So we wanted to have you on to talk about it. So I appreciate that. And I guess I just want to start out kind of open-ended. What are your thoughts in general about this MAHA report?
A lot of thoughts, but I think maybe one overarching theme is that in medicine as well as in science, details matter. And I think throughout the report, you see that a lot of details are quite glossed over. And you said that I agree with you that the report was long, but for the number of subjects that were covered, a report with that many different subjects really shouldn't shouldn't be 76 pages. It should be hundreds of pages if you wanted to truly do a deep dive and analyze the data rigorously and evaluate all of the points. And so I think the fact that it's only 76 pages really reflects that it really is a very superficial analysis, and the conclusions that were taken reflect that.
Yeah, so I'm an ER doc and you are a like real scientist, and my eyes glazed over after like page 2 or 3, because I'm like used to that. Hey, first 5 minutes of care, you know what your disposition is. So I appreciate that. I think you're proving your bona fides on this just by that intro. But yeah, I mean, maybe we can get into some things about it. I mean, you've seen a lot of stuff online about, there's fake citations, AI generated citations. Like this isn't even, or linking to real scientists for studies they didn't actually do. I don't know if you have any thoughts on all of that, what that actually means for a report like this, and maybe can you find some examples of where they actually did this? I haven't seen a ton of people talking about that.
Yeah, so there were definitely examples that, where the citation links didn't work. One of the examples was where they said that use of antibiotics was related to all sorts of long-term side effects like anxiety, asthma. There was also a link that didn't work. The citation just didn't exist for the use of corticosteroids for asthma exacerbations, additionally causing all sorts of side effects. Maybe we can just take a deep dive into one. Do you want to do that? So let's take, for example, I think RFK Jr. has been talking about the dangers of fluoride well before he became HHS secretary. And that was one of the topics that he covered in the report. So let's take a look at one of the papers that he cited to support this. So they said, use of fluoride results in a decrease in IQ in children. And that was the conclusion. And they cited a JAMA pediatrics paper. And if you actually open the link and look at the paper is interesting because it is a meta-analysis of 74 studies. In the paper itself, they say that over 50 of them have a high risk of bias, self-reported high risk of bias. And then if you open each of these links of the different studies that went into this meta-analysis, the vast majority were conducted in China. Some were conducted in India, in Iran, Pakistan, in South America. Not a single study used in this paper was conducted in the US. There's a couple of reasons why that doesn't apply. One of the reasons is that in the US, the safe range of fluoride in water is 0.7 milligrams per liter. The WHO standard is 5 milligrams per liter. The vast majority of people that were studied in this paper, ranges were between 2 and 4. So this is where we get into like details matter, data matters, levels matter. If you take Tylenol to get rid of a fever or a headache, you're taking it at a safe dose. But if you took an entire bottle of Tylenol, you would end up with liver failure. So there's a safe range for things and there's a toxic range for things. And so the exact concentration does matter. In the study where they report that there is a decrease in IQ in children, most of that occurred at the 4 milligram per liter range. But also, if you look at the data itself, what exactly was this decrease in IQ that was reported? So in each of these countries, the measure of how they evaluated IQ was different because they're different countries and they use different tests to evaluate IQs. Amongst these 70 plus studies, there are different evaluations of IQ that are being conducted. And the age ranges vary. So they range from ages 4 to about 17. And so you can tell, like a 4-year-old's ability to be able to follow through on a test and the reliability of that test is going to be very different than a 15-year-old's ability to do that. And then you're compiling the data from each of these different measures of IQ together, doing this meta-analysis. And then the decrease that they saw was just a decrease in 0.45. And that would, I think most...
Wait, so like an average IQ is 100, so 0.45, less than a half of a point of IQ was a decrease. Even if everything else was perfectly studied and everything, that's what he's citing as this massive danger?
Yes.
Seriously?
Yes.
Wow.
And then
I think I lost more than that on my 21st birthday, I would say. I don't know about Miles, but...
Yeah, I mean, yeah, for sure. I also am way more worried about my teeth than that percentage of an IQ.
Yeah. I mean, what are the impacts? I mean, you're an infectious disease doc of chronic dental caries and infections. I see people all the time in the ER, particularly in a setting where we have patients on Medicaid where states don't cover dental for Medicaid unless you're a kid. And now some of them are not covering, right? It all goes together. People who can't go interview for jobs because of a lack of teeth, people with chronic inflammation and higher risk for heart disease and strokes because of poor dentition, and we're saying, let's get rid of this thing that has transformed people's dental care because of bullshit studies and less than 1/2 of 1 point of IQ. Can you imagine that that could ever be measured to have any impact on anything?
I think it's really impressive that, amongst 70 plus studies over multiple countries, that the median difference that they saw was just 0.45. And in the highest range of fluoride, it was 1.13, I think. But, you'd think that the differences would be much more when you're compiling so many different measures. So I would say that this is great, I think. It's not concerning to me at all. But yeah, to your point about dental infections, yeah, as an infectious disease doctor, we see dental infections all the time and end up giving people antibiotics because they can't get to a dentist in time.
Right. And again, in the poor access to dental care population, a lot of the folks I see in the ER, a ton of people with tooth pain, dental infections, dental caries, right? The treatment for those folks is saving up a couple $100 to go to like a Ready Dental clinic or whatever you name it and get the tooth pulled, right? Most of us, you have a little tooth pain, you go to your dentist in a timely fashion and you get a filling, right? It's a fairly simple thing. You have many of us, I think on this call, probably we have dental insurance. Most of the senators debating whether or not to take healthcare away from 11 million people or so probably have dental insurance as part of their lifelong insurance coverage from their jobs as our representatives. And a lot of the folks we treat don't have that. So now we're going to have MAHA saying, hey, we have this really good, really terrible meta-analysis. For Miles, meta-analysis is just a group of studies put together and then analyzed as one big study. And so some meta-analyses are really...
I kind of knew
good.
That is what the analysis was.
And some are really good, right? Some have very applicable studies that seem to be focused on the same issue using the same parameters. Some are not so good. Even in a not so good meta-analysis, looking at this very tiny incremental change, this almost seems like a negative study of proving some danger of fluoride, right? Like you could almost write a report saying the benefits of fluoride and include the same bits of data and say, look, it only did this, even at higher doses.
Can I ask the scientists on this call, both of you? It seems like if you knew what the study was trying to say, you would arrive at the conclusion you're arriving at. And so it seems like it might just be that they're lying, right? Is that your takeaway from this, that they're just lying?
I'm not sure. I don't want to infer motivation.
Sure.
That I don't know what people are thinking. The conclusion that was stated in the paper itself was just that it's important to think about concentration and evaluate, considerations for that. And I think that's a fair, vague statement. And I agree, concentrations matter, but the ranges that they listed as concerning, even if we do say that 0.45 or 1.13 decrease is significant, which I think we'd have to talk to a pediatrician to hear about how significant they think that is. Those are ranges that are not used in the US. And so it doesn't apply.
Yeah. One thing I worry about, and one of the issues with the study that people have cited in a more broad sense, is the people who did it were not science people, right? We don't know their credentials. They're like many people in his little movement that he's brought on. These aren't people who actually look at studies. And so you wonder if there's a bias going in saying, we believe that fluoride is bad. RFK Jr. has been saying it for decades. Fluoride equals bad. And so we found this meta-analysis that the conclusion shows, oh my God, look, IQ went down. That's bad. And so let's include that in here as a proof point of why fluoride is bad. And someone like you, and even me a little bit, and even Miles a little bit, sorry, Miles, not to be so incredulous, can look at that in a very brief time here, and the way you explained it, I think really laid it out, I think, for listeners, that this is not proving fluoride equals bad. This is showing a very tiny change in a study that looked at fluoride levels well above anything people experience in the US, and also then showing, look, not really bad. I don't know. It feels like a lot of this whole thing is they came in with an opinion about what they believed, and they tried to find some bits of data they could call studies that kind of prove that opinion. I forget from my days learning this stuff what kind of bias that is, but you go in with a preconceived notion, right? Anchoring bias maybe, or there's different biases, but I don't know. Any thoughts? Like, not to infer lying, but to infer that.
Yeah, I think you bring up a really valid point. The administration has been talking about radical transparency, and we actually have absolutely no idea who wrote this report. They haven't disclosed who wrote this report. And so, that would be a great start. Who wrote this?
Yeah.
What are the
Yeah.
credentials? Was there a different group or body to evaluate each of these different topics? Because if I was in charge of this, or, if any of us were in charge of this, we'd say, we want pediatricians and people who have been doing this for a really long time to evaluate this topic, and people who have been studying obesity to evaluate this topic, and not just like somebody who is not a scientist evaluating all the topics. There's this, I don't know if you ever watched the show Arthur growing up. The aardvark, yeah.
Oh yeah. Oh heck yeah. Heck yes.
There's this scene where like all the kids are gathered around the kitchen and they're trying to make a cake, and so they're reading the recipe and they're like, one lub flour. What's lub? They look at each other and they're like, what's lub? And they're like, skip that. And so they end up making a cake without the one lub flour. And so this is what it feels like, where it's just like somebody who wasn't trained in doing something. It's just like, don't know what this is. Move right along.
That's great. That's the first Arthur reference I've heard in any podcast, and that's so awesome. I even had to remember what Arthur was. Yeah,
Yes.
no, and I appreciate that. And I think taking that specific example, I think is important, because a lot of headlines and a lot of even entire stories just talk about erroneous citations, and that they got them off of OpenAI, and they left the link in for OpenAI that generated this fake citation. I think AI does hallucinate once in a while. I think that's the term people use, and just comes up with shit that isn't out there. Sounds like these guys coming up with shit that isn't out there is kind of part of the MO of doing this report. So another piece of this was sort of RFK Jr.'s long held belief in the danger of vaccines. And you seem like a really good person from what you do to kind of dispel that, just to know, from the start, why vaccines are so important. I know you shared with us some examples that you talked about, and then anything in the report that actually makes a connection between vaccines and bad things.
I mean, vaccines, they're probably one of the most powerful scientific innovations that have changed the course of medicine. For example, meningitis. Historically, meningitis in children was caused by Haemophilus influenza B and strep pneumo. During that era, before those vaccines were available, pediatricians would be doing LPs, lumbar punctures, to evaluate the bacteria that was in the CSF, and test whether somebody had meningitis, and they would just be so good at doing these LPs. But now, thanks to the vaccines, there's so little meningitis that is seen that many would say that pediatricians are less qualified to do LPs because they just don't see as much meningitis. That's how much just these two vaccines have changed. And you can, take a look at any particular vaccine and evaluate it that way. The measles, mumps, rubella vaccine, right? All of them.
Yeah, when I was coming up, I've got a decade or so on you, and I was coming up in the mid '90s in med school even, and boy, our protocols for evaluating kids with fevers, even then, right? And those vaccines have been out, but they hadn't firmly got their footing into all the kids, right? The penetration wasn't nearly ubiquitous like it is, or like it had been until recently. And our protocols for evaluating kids like 3 months to 36 months, because younger kids still, they end up getting bigger workups when they have fevers. Kids, under a month, kids 2 months. But like for older kids, we used to like get some tests, and like a lot of them would get these. And when you say LPs, that's a spinal tap for people listening who don't know that. That's like sticking a needle in your low back. It's a thing. I do that. I do it probably, I don't know, certainly several times a year now. I used to do it a lot more, in the 90s and into the early 2000s. The other thing Haemophilus influenza vaccine got rid of was epiglottitis, a horrible infection where like the tissue in your throat as a young child gets inflamed and blocks off your ability to breathe. And kids would come in leaning forward in a tripod fashion, drooling, not being able to breathe. And they often have to have like emergency surgery, cutting their neck open to put tubes in to breathe for them. And it mimicked croup. Croup is a simple thing. Most parents have seen a kid with croup. I've seen my own kids. It sounds horrible. Routinely, it's not life-threatening, right? But we used to get all sorts of x-rays on kids because we were like, is it that really bad thing, epiglottitis, or is it just croup? Get x-rays, admit them to the hospital overnight. And we don't do that anymore. I haven't gotten an x-ray for croup in probably 10, 12 years. I haven't admitted a kid to the hospital for croup in almost ever now since I've been out of residency. This is because of vaccines. I mean, maybe we should be showing people videos of people getting needles stuck in their back and say, hey, because of vaccines, your kid doesn't need this, right? Like, don't listen to that RFK guy. He doesn't have it. So anything in the MAHA report that in any way tells us, hey, yeah, maybe vaccines are bad. Maybe they do cause autism or other diseases. Did you find anything like that?
The thing about fear is that it's really hard to dispel, even with facts. So, there's this. In 1998, there was an old Lancet paper that was published by Andrew Wakefield that suggested that there was a connection between the MMR vaccine and autism. One, that paper has been retracted, and it's been proven to be incorrectly analyzed, falsified, and it's been retracted. It's been unpublished by Lancet. And then since that time, many countries have published many papers showing that there is no connection between vaccines and autism, and doing deeper dives and looking at different preservatives that are used. And it's just not there. But that's the thing with fear. It's really hard to dispel with facts. And I don't know what the best way is to do that. That's something that we do need to, as physicians and scientists, really take the time to understand, because I think we're losing the war here, in medicine, because the fear takes hold.
So they cited in the report, I believe, that they want to go back and retest, right, a bunch of vaccines and do placebo-controlled trials on a bunch of vaccines. Are we one placebo-controlled trial showing no harm away from convincing RFK Jr. or the MAHA movement that vaccines actually save lives? I mean, you think we're there?
I mean, if that's what it takes, then that would be great. But I don't think so, because, so we have this massive 650,000 children study done in Denmark that showed that there's no link between MMR vaccine and autism. In Japan, they looked at children that were diagnosed with autism and then did a retrospective analysis to see, those that were vaccinated versus not, and found no association. Similarly, large studies done in the UK also validating the MMR vaccine and autism. In the United States, the CDC has conducted many studies. Millions of people have been studied for this. And so I don't think adding another 1,000 or so to this body of evidence is going to change anybody's opinion. And how we change that opinion is actually a really important question, because that's how we're going to be able to move forward. And I don't know the answer to that.
Yeah. Well, yeah, you're definitely not alone. I don't know. Maybe Miles, you're the political guy on this. Do we have any data from how we change people's minds, sort of, I guess, politically about various issues that can help inform us?
Politically, yeah. On vaccines, I think it's a sticky wicket. I'm not exactly sure what we're going to do here. So I am.
Yeah. And it's like a lot of the report, just like the fluoride and kind of like the whole administration and the MAHA, the HHS department. It comes down in some ways to incompetence, right? They put all these things out there, going to question this, going to look at this, going to look at that. Hey, do they ever actually do that? Who knows? Maybe this is just a nod to the MAHA folks out there to keep them politically on the side of Donald Trump and his cronies. If they do, is it real? Is it just sort of half-assed? Just again, as a nod to these folks? Does it just continue to keep the embers of the anti-vax movement smoldering so it never goes away and they can continue to use it? I don't know. Miles, you're thinking about something.
I'm just thinking about the moral choice of saying false things about vaccines and what that does to children and what that does to families in order to keep your political base together. And not even your whole political base, 2% of your political base. You're trying to keep 2% of the MAGA movement, the MAHA portion. It's not very big. It's growing, unfortunately, but it's not very big. And you're willing to really hurt a lot of kids to that end. And I was just thinking about how gross that is.
So if you follow the money, he's made money from lawsuits against vaccines. So, I wonder if there's an ulterior motive there, and it has nothing, he's not interested in, protecting children, protecting families. It's just, if you incite enough fear, then you can win these lawsuits and, have the world support you on it because they're scared.
One other thing I wondered if you'd want to talk about, because it's something I have not heard at all talked about this report, and they make a general statement that children in single-parent households more likely to have worse mental health, anxiety, depression. But then they don't talk about anything about how we try to have a prescription for kind of, what do we do about that, right? It's just a blanket statement. And you had some thoughts about how that may intersect with other policy choices of Donald Trump and Republicans in Congress and Republicans writ large that maybe cut against this?
I think it's sort of what you're saying. Like they get really close to getting to the point, but then they end up missing it. So they basically cite an association between children and single parent households and saying that they're more likely to have worse outcomes in terms of mental health, anxiety, depression. They don't make any acknowledgments on ways of fixing it or systemic reasons of what causes it. But if you take a look at the data, shortage of access to contraception in this country, shortage of access to comprehensive reproductive health care. It's known that access to abortions reduces teen pregnancies, teen brides by 20%, teen pregnancies by 34%. Access to legal abortions delays an unplanned pregnancy by a year, which can result in an increase in wages later on in people's career. And then a child that's born due to lack of abortion access, like an unwanted pregnancy, is 60% more likely to be living in a single parent household, 50% more likely to be living in poverty, 45% more likely to be a welfare recipient, 40% higher odds of dying as an infant. There are a lot of outcomes that are associated with it. And if you don't try to address, what causes these things and just sort of make these associations and say, like, associations exist, then what are we actually solving here? We need to be taking steps back and figuring out what caused this, how do we fix this, what access to care do people need at a higher level so that they don't end up in situations where their child is being born with higher risks of mental health issues.
Yeah, I think that's super important to bring that up. And maybe they didn't want it to be 100 and some pages long, so they just had to keep it brief at that level. But again, yeah, just the idea to say, hey, this happens, but then completely ignore, big swaths of their party in states where they've criminalized basic reproductive health care, and Supreme Court justices and others suggesting, well, maybe contraception isn't something everyone should have a right to. Like, that's pretty scary stuff, and it has real world implications. I mean, just that data right there, it tells us, and I see it. I mean, you feel it, anecdotally doing what I do for so many years. I'm sure you see it in medicine, and all of us it's intuitive but the data is real. These guys don't want to deal in real data and real solutions to these problems they bring up.
Yeah, it's also kind of ironic that they are, saying that they're interested in investing and figuring out the contributions to chronic diseases, but then just this week dismantled the NIH body that, studies chronic diseases. So don't know if there's real interest in doing any of this or if it's just.
Yeah, there's not real interest in doing in doing science. They're just doing power and money. That's all.
Yeah. Well, I don't know, Miles, if you have any other questions, or Dr. Paul, if there's anything else like you want to say about this more comprehensively, anything. I think we dug into a lot, and I honestly really appreciate your takes and you're kind of digging into a few examples here. I think it's certainly helped me. I think it's helped Miles. Hopefully help people listening.
Yeah, I think everything that you guys have said I agree with completely. It's, details matter. And one thing that I forgot to mention earlier in terms of the correlation that they cite in terms of an increase in autism that's been seen as we've used vaccines more, the definition of autism has changed so dramatically over time, and it's become much broader. The original DSM guidelines from the 1980s, the definition of autism was super narrow. It was basically, impairments in social interaction that is not schizophrenia, but just a little bit different from that. And then there was a revision in 1987 to expand it with the DSM-3R criteria, and then the DSM-4 in 94 expanded it further, the DSM-5 in 2013 expanded it further. And each of these guidelines, the definition has changed. So, is there been an increase in autism? Yes, but the definition has evolved so much over the years that if you miss that detail and you just say, oh, the number has increased, you could be skewed in your interpretation of that.
I didn't know that.
Yeah, and it's, rightfully they call it a spectrum disorder, right? There's a spectrum of disease of autism, and it used to just be sort of a binary, you are or are not, quote, autistic. And it's, I've seen it change even over my career, for sure. I think that's important as well. And RFK Jr. has never mentioned that once in a single interview on a single podcast. That has never come up. That bit of nuance that's like super important. So thank you for bringing that up. I appreciate it.
And then I think the other point that's worth making is that correlation is not causation. I'm not a pediatrician, but I have friends who are. A lot of pediatricians have experienced situations where they were just like a minute away from administering a vaccine, and the child that's in their office has a febrile seizure. And, had they administered that vaccine just a few minutes prior, then, many people would have been like, oh my gosh, this vaccine caused this febrile seizure and caused these complications. But, had you waited, you would have seen that it would have happened. It's so easy to just use fear to stoke concern.
Yeah, I had a general surgeon who was one of the best doctors I've ever worked with at my hospital who retired a few years back. And I would always tell him when the patient last ate something, if they had a belly pain, they may have appendicitis or something else. He said, Rob, I stopped asking that question. And he was making sort of a social commentary on people and their dietary habits. But he said, the people that I encounter mostly ate something in the last hour at any point in their life. And so I find it hard to attribute anything that happens to them after that, because most people who get in a car accident probably had something to eat in the last hour. And unless they were eating and distracted from driving at the moment of the crash, probably has nothing to do with it. So I do appreciate that. And that's a hard thing. And overall with MMR, we know that most of the characteristics that then lead to a diagnosis of autism happen at an age where you're now supposed to be reaching milestones, which also happens to be shortly after we give MMR in the vaccine series. But it's just some correlation. It just happens to be when these things happen, and the data have borne that out. It is really hard to combat that in people who have witnessed it happen to their kids with a whole bunch of papers that conclusively show this just isn't the case. So yeah, you're right. We have our work cut out for us. I would love you to be not as busy as you are treating infectious diseases that could have been prevented. I'm sure you would prefer that part of your practice didn't exist. But I guess we'll keep on working on that and keep on fighting back against the BS that's coming out of HHS nowadays.
Yeah. I mean, maybe Miles, I think you might be better at answering this question. In the last administration, around elections, the criticism was that the Dems didn't address, people's pocketbook and say, it is expensive when you go to the store, and just kept citing data and saying, this is, the best economy that the world has ever seen. We are the envy of the world. And like trying to fight people's feelings or their real world experiences with data. That doesn't work. You have to say, yes, it is more expensive, but it's going to get better because of blah, 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 right? Like you can't deny people's real world experiences or their feelings. That's completely non-constructive. So I don't know if there's any lessons that we can take from that to use in the vaccine hesitancy world that you would recommend for us as physicians.
I am not qualified to talk about how to get people who are vaccine hesitant to take vaccines. For sure. As a general matter, I think the stats don't work, right? Like we have a problem of social contagion with vaccines, is that people are friends with folks on Facebook or they're friends in real life who are vaccine hesitant, and it's spreading at a rate that is a bit of a problem. But I'm not qualified to offer a solution. I just can identify that. It worries me. It troubles me greatly.
Yeah, absolutely. Absolutely. Well, on that, again, appreciate all of your time here. Can say Dr. Priya Paul, infectious disease scientist, studies innate immune pathways in HIV, sees patients in the hospital with a variety of infections, and runs HIV clinical trials. Also, we're so happy a member of the board of directors of the Committee to Protect Healthcare. Thank you so much for offering your expertise, for taking your time with us today.
Thank you.
Well, that was a great interview, Rob. I'm going to go ahead and read us out. Today's episode was written by Chris Savage, Dr. Rob Davidson, and me, Miles Baker. It was produced by Amelia Dillenschneider, Aslan Ibrahim, and Joel Bryson. Music was by Annette Somerset at Dune Flower Productions. If you enjoyed today's show, please subscribe and leave us a rating on YouTube, Spotify, Apple Podcasts, or wherever you listen. Physicians, your voice matters. Join the fight for better American healthcare by becoming a member of the Committee to Protect Healthcare. Visit www.committeetoprotect.org to learn more. And we'd love your feedback. Send your comments and suggestions to feedback@pageinamerica.org. We read all your emails. Thanks for listening, and we'll see you next time. See you, Rob.